What is the success rate with dental implants, and what has been your experience over the years?
Dental implants have been a game changer for dentistry. It's like the car or the jet plane was for transportation. In the past, if a tooth was lost or many teeth were lost, we used fixed or removable partial dentures, forms of bridges. In the fixed bridge, teeth had to be ground down into stumps and crowns slid over those teeth. Those teeth paid a price and can often result in problems down the road. Same thing with a removable partial denture. It's almost the equivalent of having a pair of pliers on the teeth. Over time, that can cause problems. Dental implants replace an individual tooth. Sometimes they're used in multiples to have a bridge that's supported by dental implants. The good thing is dental implants don't decay. They don't have nerves to go bad as natural teeth do. When bridges and partial dentures fail, they have to be remade, sometimes at an additional price to the teeth. If the teeth get decay or the nerves die, sometimes, maybe more often than not, the entire bridge or partial denture has to be remade. The beauty of dental implants is, once again, it's an individual tooth replacement. It doesn't involve or affect adjacent teeth. When a dental implant is used to replace a tooth or a few teeth in what we call the aesthetic zone, that's the part of the dentition, the set of teeth, that shows when somebody smiles and speaks. If that is done, and done knowledgeably and skillfully, most lay people, if not all, can't tell the difference. In fact, a lot of dentists would have difficulty telling the difference when speaking to someone with an implant-supported crown that replaces a missing tooth. However, it takes a lot of knowledge and a lot of skill to do it, to achieve that result. It is not uncommon that I will receive a patient, either self-referred or referred by a colleague, who had been treated previously to have an implant placed where they were missing a tooth. And the implant placement didn't quite achieve what the patient or the practitioner was looking to achieve. In this case, the oral surgeon who placed the implant attempted to resolve the problem. And the problem is that the implant is outside of bone and gum, which threatens its long-term survival. And also the patient had a high smile line. Her lips came up to here when she smiled. Some people would call that a gummy smile. So it was an aesthetic, a cosmetic problem. I decided to treat the implant and not remove it, and to do so required a number of procedures because it is a plastic surgical procedure and we can't always nail it at once. Look at the before, the level of the metal from the implant that's sticking out of the gum, the loss of gum on the adjacent teeth. That's significant. It's tough to recreate a virgin smile. In this post-treatment photograph, we see a dramatic, substantial change in the appearance of her teeth. The very long tooth that had the exposed implant, its gum level is fairly close to the adjacent teeth, and certainly no implant is showing, or the long neck of this crown. And there's a substantial zone of gum, which is a protective tissue, that is now in place and should guard that tooth against adverse changes. Of course, we have a consistency of shade and color, and to a great degree a consistency of shape of the teeth, despite the original problems of exposure of tooth root to each side of the implant.